Good evening, everyone. I'm Sandra Clark, WHYY's Vice President for News and Civic Dialogue, and thank you for joining us for this program in DuBois's footsteps, the health of our cities then and now. In 1896, W.E.B. Du Bois moved into Philadelphia's 7th Ward to write what would become the first sociological scientific study of the urban poor in America. More than 100 years after the publication of Du Bois's The Philadelphia Negro, racial health disparities persist and in some cases have widened, as we have seen even more clearly during the pandemic. And today, Philadelphia is the poorest of the largest US cities, with more than 20% of residents living in poverty. A growing body of research shows that social factors such as housing, education, and income shape the health of people in countless ways. But how has our understanding of the health of our cities changed over the last century? On WHYY's nationally distributed radio show, The Pulse, and through our health and science reporting on radio, web, and podcast, we have devoted substantial resources to covering issues around health disparity and equity. We'd like to thank David Blumenthal and his team from the Commonwealth Fund, Beth Ann Fox, Barry Skoll, and Lori Zephyrin, for supporting this program tonight. And it is because of the support from the Commonwealth Fund that we have added to our WHYY team, Health Equity Fellow Sojourner Ahebi, tonight's moderator. We also would like to thank our esteemed panelists and our WHYY members, of course, who make so much of our programming and engagement possible. And now, without further delay, let's get the evening started with a short video about the lasting legacy of W.E.B. Du Bois's seminal work, The Philadelphia Negro.
This is Washington Square, home to Philadelphia's many historic sites and a bustling shopping district. But a little over 100 years ago, this area would have been close to the historic 7th Ward, where the city's largest population of Black Americans lived at the time. Sociology professor Tukufu Zuberi joined me to talk about W.E.B. Du Bois's groundbreaking 1899 study of this community called the Philadelphia Negro.
So the 7th Ward was one of the primary residents for African Americans, especially for the upper class African Americans, because of its proximity to the more affluent sections of the city. And many of the people who worked and lived in the 7th Ward worked for the more wealthy patrons of the city, but also had a number of businesses and engaged in a lot of entrepreneurial activities. So the 7th Ward would have been a central place, and hence the interest of all of the political parties.
And so at this time, we have sort of like this major African American population living in the Black 7th Ward. And then in the late 1890s, W.E.B. Du Bois, who would, become a champion of civil rights, at that time, he would have recently graduated from Harvard University as the first Black man to graduate from there with his PhD. He would have been working as a professor at one of the historically Black colleges at Wilberforce. And then he gets this invitation to come to Philadelphia. Can you tell me a little bit about what that was all about, who invited him, why they wanted him to come, and what he was sort of set out to do?
Right, so the political forces at play in Philadelphia were really in contention for political power. And this new African American community, and it's new, and not because of it didn't exist, it existed for a long time, but it was new because of its configuration. Lots of migrants coming to Philadelphia, you know, especially after enslavement, which was only about 30 years before this time. So you get a big influx of African Americans into the city, and they're kind of mixing with this old community, but they don't have the same politics or political mindset. And the powers that be said, we need to know what that mindset is. And not only did they say that, but the large economic forces in the city said, we need to know more about this particular community. And they said, if we want to know that, and if we want to be able to be in the position of influencing their vote, then we need to know more about them as a community. And that's why they invited DuBois here. The University of Pennsylvania and all of those individuals who commissioned DuBois saw the Negro as a problem. So when they said they wanted to study the Negro problem, they wanted to study something which was familiar to everybody in the United States. Negroes as a problem. Negroes as people who come with poverty. Negroes as people who are uneducated. Negroes as people who are unhealthy. Negroes as people who are just congested in these tight spaces and bringing their lack of sanitation to the city. All of the crime, all of the prostitution, all of the poverty. What's wrong with these people?
Right, absolutely.
DuBois took that and flipped it on its head. DuBois flipped the whole thing on his head. He said, I am not here to study the Negro as a problem. I'm here to study the Negro's problems. And so how do you do that? Well, first you have to talk about who are they.
Right.
And to talk about who are they, first he wanted to situate them in a space. And to do that, he took the census maps and the census tracts and he marked where he found the people. He took his survey data and he used that to superimpose it on these maps to show where people were in poverty, where the crimes were being committed, where African Americans owned the businesses, where did the elite, the wealthy African Americans live, who did they serve, where did they serve them, where was the public transportation, what were the health facilities that were there. So what he established is a more comprehensive view. It changed what the possibilities of doing a study of health, a study of class, a study of life, a study of celebration, a study of churches could be. You find that all nested in the Philadelphia Negro. Because what he found is that the African American community, the Philadelphia Negro, was not one cesspool of poverty, crime, and degradation. It was not a group of people who could not read. It was a group of people who had been denied proper education. It was a group of people who had been prevented from working fully, having a full livelihood in the society. It was a group of people who had churches. It was a group of people who had areas to celebrate in. It was a group of people who were a vibrant community doing very important things in the United States. This is what DuBois showed us.
Good evening, everyone, and welcome to In DuBois's Footsteps, the health of our cities then and now. I'm your host, Sojourner Ahebe, and WHYY's Health Equity Fellow. As you just saw in the video, the Philadelphia Negro is more resonant than ever. And tonight, we're asking you to reflect on the laws, policies, and historical forces that have shaped the health of city residents from today to DuBois's time. I'm so excited to be joined by such an amazing panel of speakers tonight, so I'm going to keep their bios short so their interventions here can shine through. We'll also be sharing, taking questions from panelists during the discussion and at the end of the discussion. So please feel free to put your questions in the chat and as they come up, and we will answer them accordingly. I just want to say, without further ado, I'm really excited to welcome Dr. Elijah Anderson, who's the Sterling Professor of Sociology and African American Studies at Yale University. He also wrote the introduction to the 1996 edition of DuBois's The Philadelphia Negro. We're also so grateful and excited to have here with us today Tawanda Austin, who's a senior community health worker at Penn Medicine. She's worked with over 300 patients in the Philadelphia area, connecting vulnerable populations to the health that they need. And last but certainly not least, we're really pumped to have with us today Dr. Sherelle Barber, who is the director of the Ubuntu Center on Racism, Global Movements, and Population Health Equity. She's also an assistant professor of epidemiology and biostatistics at Drexel University, where she focuses and studies on the intersection of place, race, and health. Thank you all so much for being here with us this evening. I'm so excited to get into this conversation with all of you today. Dr. Barber, I'll actually then start with you then. So as we know that a lot of Philadelphia elites and philanthropists at the time that DuBois would have been studying in the city sort of had these epidemiological ideas about things like poverty, that it was something to be like quarantined away. And they ascribed a lot of poverty within the Black community to there was just something wrong with this population. And we know that this is a sentiment that has existed for a really long time, and we really saw begin to crop up during the COVID-19 pandemic, where while health systems and the media were recognizing disproportionate COVID burdens in Black and Latino and Asian American communities, at the same time, under that recognition, there was this narrative that there was behavioral things that were contributing to their higher rates of chronic conditions that then predisposed them to getting COVID-19. I'm wondering if you, as an epidemiologist, can talk a little bit about how our studying of racial disparities has changed in the 100 plus years since the publication of the Philadelphia Negro, and what sort of that approach has looked like within your field, and how perhaps has your approach been different?
Absolutely. Thank you so much. And it's definitely good to be up here with the fellow panelists. I actually want to take that question a step back and just say kind of the contributions that actually DuBois made to the field of social epidemiology, because I think they were really critical. And it points out the fact that along the kind of history and historical contours of public health, you have these dominant narratives that are purported by mainstream institutions, universities, and you have always had counter narratives. So during the time of DuBois, like you said, there were these narratives about some type of inherited problems that Black Americans had at the time, that it was their quote unquote genes and their behaviors. In that time, it would have been called their hygiene or lack of sanitation. And there was widespread documentation as this being some of the major explanations of disease distributions within Black populations. And in the 10th chapter of the Philadelphia Negro, DuBois actually helped to kind of counter that narrative when a couple of things he did. One, he put into, he looked at mortality rates by ward in the city and showed these striking inequities depending on where people live. It was one of our first epidemiologic, in some ways, studies on neighborhoods and health. Also looked at whites living in similar conditions to Blacks and saw that there were similar rates of mortality. And his argument was then that this was a social problem. It was the social and the environmental conditions that were producing the health outcomes in these populations, especially if you could see this variation in mortality rates and even similarities between, whites living in similar conditions. And then finally, he pointed out some national trends where Americans in Philadelphia had lower rates than, for example, mortality rates than whites living in South Carolina, right? So again, showing that it was the conditions, it was the economic status. And for Blacks, the fact that an overwhelming number of Blacks had these poor health outcomes was a product of these broader structural factors, right? So again, you had these mainstream narratives and you have counter narratives. And continue throughout kind of the history of public health. When you have the emergence of chronic diseases as major causes of health, again, you have behavioral kind of explanations or lifestyle explanations why Black Americans have higher rates of hypertension, diabetes, strokes, and obesity. But in the 1980s, Dr. Sherman James, came up with a theory of John Henryism and talked about the coping of Black Americans against these racist systems of oppression as helping us to better understand hypertension and stroke, particularly in Black Americans. And then the final point I'll make is that we've moved to a social determinants of health, kind of framing of health, which is good, but yet at the same time, some of the other narratives are around genetics and biology and biological differences. And then finally, what I'll say is that in the last year, what we've seen, especially with the emergence of COVID-19 juxtaposed to the state-sanctioned violence against Black bodies, is racism as a public health crisis. And that is becoming mainstream. Now, whether or not that's going to change anything is yet to be seen. It is becoming a more mainstream narrative. Over 200 cities and counties have declared racism as a public health issue or problem. And in fact, the CDC in April of this year put out a statement about racism as a crisis, right? So again, you have mainstream narratives that have been more individual focused, more focused on genetic or biological explanations. But I'm glad to see a trend towards these more social structural determinants, really thinking about how racism shapes inequities, which is really important because how we frame problems is very important to the solutions that we develop to solve them.
Absolutely. Thank you so much for laying that groundwork on DuBois and for bringing up something that I actually want to ask you, Ms. Austin, about social determinants of health. You're a community health worker, and of course you work across a whole complex web of, societal, economic, various factors that folks are sort of like in this complex web of navigating in their everyday that may or may not sort of create barriers for them to access care. So I was wondering if you could talk a little bit to us about what community health workers even are, for those of you in the audience who may not be familiar, and how your approach differs than, say, a hospital or a doctor.
Sure. So community health workers are trained people who are natural born helpers. We are the type of people who you would meet like at a community group event or just simply giving soup to your sick neighbor. Me in particular, I'm considered the mayor of where I live because I go outside and I just sweep up everything and make sure that everything is okay and everybody come to me for things that they may need for them to advocate wherever. What makes a community health worker different from a clinician or a physician is the fact that physicians are often confined to just the office or the hospitals. And what they really want to do is focus on the reason that the person may be there. And they only get about 30 to 45 minutes to be with that person. Community health workers, we do something called a meet the patient interview. And what we are doing is trying to figure out who is that person, what is important to them, and barriers that they are facing so we can try to help in those areas. We also try to empower the patients so that when we're done working with them, they are able to access those resources and navigate through them.
Absolutely. Thank you so much for sharing that. And like Ms. Austin was saying, community health workers, they take a broad approach to health. So you can't address someone's diabetes if they're also going through, housing insecurity or they need their heat turned back on. There's an idea that all of these things, people are comorbid. They're not just experiencing one thing at one time. And it's important for all of our health systems and our healthcare workers to sort of work within that model. And Dr. Barber, you've studied this on the population level, looking at the impact of neighborhood segregation on health. And as we know, Philadelphia is one of the most racially segregated major cities in the United States. And it's also a city where we saw a significant COVID-19 burden among Black and Latino residents in the city. At the beginning of the pandemic, you participated and led an incredible project and brief entitled COVID-19 in Context. I was wondering if you could talk to us a little bit about the impetus for that project and how something like racial segregation might actually figure into COVID-19 racial disparities.
Absolutely. So, as a social epidemiologist, when the pandemic hit, it was just like, for us in the field, especially those of us who've been doing work in racial inequities, we really felt, colleagues and I around the country really felt a need to help to shape the narrative, right? We knew that much of that narrative would put the onus of the burden of COVID-19 on the populations directly impacted and most harmed by it. And we wanted to provide different frameworks for thinking about why Black Americans in particular, and also other marginalized racial groups, were experiencing higher rates of COVID-19. Because people can look at the same data and come up with very different theories about why those data are, right? And so even the Surgeon General early on was blaming Black Americans for the higher rates of COVID-19, the lack of or the number of chronic conditions due to, again, lifestyle behaviors, et cetera. And so we wanted to form a counter narrative. The other impetus for this was I was early on in the pandemic asked to be the coordinator and kind of advisor to the Poor People's Campaign, really advising them on their health justice response to the pandemic. And the Poor People's Campaign does a lot of activism and advocacy work around systemic racism, systemic poverty, and ecological devastation. And as a part of that work, I was hearing directly from the ground about how people were experiencing those low income workers and or essential workers, as we deemed them at the beginning of the pandemic. What communities were experiencing, the lack of testing, in certain communities. And so, as a scholar and an epidemiologist at the Drexel School of Public Health, embedded within the Urban Health Collaborative, wanted to use data to show how that was playing out very specifically here in Philadelphia. And so we took maps of historical redlining, because again, we know that the predecessor of racial segregation in this country are these racist policies and practices such as redlining and others that have produced the segregation over time. It then lead to these structural factors related to housing, related to access to healthcare, et cetera, that would put Black Americans in the city at risk for both exposure to the disease, but also susceptibility to more severe cases and death. And we wanted to document that and put that all in context, because again, how we frame an issue is inextricable to how we solve it. And then finally, we put forth a set of recommendations that were in the short term. What are the things we need to be doing now to mitigate the inequities? And then what are the long-term solutions to this? This pandemic exposed so many of the inequities, these structural issues that are rooted in systems of racism and other forms of oppression. How do we reimagine Philadelphia so that when the next crisis comes, when the next pandemic hits, that our communities aren't the ones bearing the burden, right? The last thing I'll say is we followed that brief up with a storytelling project and some really powerful stories from local folks who were on the front lines in terms of making policy decisions, nurses, community folks. And one of the quotes from that struck me was a young man who said, what's a pandemic to a person who has been in a survival mentality all of his life, right? And I think that we have to grapple with what this pandemic exposed, the pandemics that people were in prior to the pandemic, and how we move forward as a city to really address these structural issues.
Absolutely. Thank you so much. And this sort of brings me to a question that I want to put, in your ring, Ms. Austin. So we know that, Philadelphia has had a long history of residential segregation, and there are clear connections between, as Dr. Barber has just described, between racial segregation and health outcomes, health disparities. And so when we're looking at a community like, the Black 7th Ward and sort of the shadow of urban renewal that happened in the 50s onwards, and sort of, this gentrification that's also happening within our city today, by the time that someone shows up to a health clinic, to a doctor, to a hospital, they're battling a myriad of social issues that are going to manifest in their body and in their health. So I'm wondering, Ms. Austin, if you have a particular patient story that you might be able to share with us and reflect on where someone's lived environment or their neighborhood made it, created an impediment for them to get the care that they needed, and how were you able to intervene in a way that perhaps that was different than what a doctor would be able to do or what their hospital would have been able to provide?
Sure. I'm going to make it very general due to HIPAA reasons. But we have many patients who are experiencing severe trauma. Maybe they've been touched inappropriately when they were younger, or we may have like grandparents who couldn't actually make it to the appointment because they had to go to court with their grandchild, or simply the patient is hurting so badly that they can't even get out the bed that day. And so often what we hear providers say is that the patients are incompliant, but they don't actually get a chance to go to these patients' homes and see what those patients are dealing with. We deal with high-risk patients in the West, Southwest, and South Philadelphia area, which are very poverty-driven areas where there's a lot of gun violence happening. And we as community health workers, well, I can say that I've been to funerals with patients. I've been doing so many intimate things with patients that doctors won't ever get a chance to do. So. Yeah.
Absolutely. Yeah, thank you so much for giving us a little bit of a look into what that looks like. Dr. Anderson, I see that you've joined back with us. I did have a question for you because we're kind of having a conversation right now about sort of the legacy of residential segregation in Philadelphia and beyond. And we do actually have a question from John Colgan Davis. He wanted to know what happened to the Black 7th Ward in the 1950s onwards in the wake of urban renewal and gentrification that followed, and what perhaps new forms of residential segregation took place.
Yeah, well, you can't really separate the present from the past. And as Dr. Zuberi mentioned, DuBois was invited to come to Philadelphia to study the situation of the Philadelphia Negro. And he's correct in pointing out that many of the white people who invited DuBois had a sense of what was their problem, so to speak, and they were a problem in themselves. But as they tried to live in this community, very oftentimes they were, having to deal with white supremacy. You see, I mean, DuBois points out in his book. DuBois went to Harvard. After Harvard, he went to Wilberforce. He taught there. Susan Wharton of the Wharton school family and the provost at Penn invited him to come to Philadelphia to study the situation of Black people, the Philadelphia Negro. And they had a notion about how Black people were basically causing the city to go to the dogs. They had these presuppositions already set in their minds. And David Levering Lewis's book about DuBois kind of points this out, and DuBois points it out in his autobiography, A Dusk of Dawn. And I suggest that you read those books, read The Philadelphia Negro. Justice Taney said in 1857 that Black people had no rights that white people were bound to respect. He said that in 1857, and he was slave or free. Black people just didn't count for this man. But of course, we have the Civil War, we had emancipation, and Black people left the plantations and went north. They came to cities like Philadelphia. But their stigma, that is the way they were regarded, both followed them and preceded them. And town after town after town, white people told Black people to keep going. And they encountered in these places immigrants, white immigrants, many of whom had their minds made up about Black people. And very oftentimes the Black people were relegated to the poorest sections of the town. This happened throughout the Midwest, the migration to the north and to Philadelphia, but it happened in Philadelphia itself, you see. And basically, this place where the Black people live became the Black side of town, in a sense. And in Philadelphia, it's peculiar because Black folk oftentimes lived in the 7th Ward, and 7th Ward was, as Takufa Zuberi points out, was mixed. I mean, you had well-to-do people, you had poor people, people living together. They couldn't easily segregate Blacks, and these people oftentimes worked for the white people, basically. And eventually, as time passed, the white people who lived in these communities left those communities where Blacks, came in. And this created ghettos, as it were. And what's important here is the notion of the iconic ghetto, the place where the Black folk live. I mean, today, the ghetto is not just a physical space. It's an icon. It's an icon. And I've written about this, the iconic ghetto, basically. And so as a Black person moves about in the society, this person is met with a deficit of credibility compared to his white counterparts, basically. And in every person, every institution, this Black person encounters and connects, I mean, basically, those folks give this person a deficit of credibility compared to white people, in a sense. And so this is manifested in housing, it's manifested in healthcare, it's manifested in employment, and this is over the years of systemic racism, you see. It's not a simple thing, but DuBois pointed out way back when that it was kind of a beginning, and we're seeing the fruits of that right now. Every city of any size has a Black community, a place where the Black folk live. And that place basically has a kind of a stigma attached to it. And these places grew and became more elaborate. And today we have gentrification. So white folks can move into a community and increase the property values just by moving in. In other words, white skin is capital, as they move in. I mean, that just says a lot about white supremacy right there. And so places like the 7th Ward became gentrified. I mean, in fact, the gentrification that occurred there was some of the first gentrification in the country. I mean, the areas around Spruce Street and Pine and 7th and 8th and those streets, those used to be Black communities, I mean, they weren't always that way. The housing deteriorated. The code enforcement was limited and became like a ghetto area. And in the 1970s, the city and various institutions, they encouraged white folks to come in. People had money and fix these places up. They got them for little or nothing. And they had urban renewal, which was a way to put Black people out. So that was the early gentrification. And now it's on steroids, if you will. And
Absolutely.
This is years later. But this is what happened to the old 7th Ward. And I won't go into great depth about this. I do cover this in my new book, forthcoming book, Black and White Space, which is coming out in December. Black and White Space, so watch for it. But it points out.
Thank you so much for laying that groundwork, Dr. Anderson. Dr. Barber, just to shift the conversation a little bit, despite overall population improvements in population health disparities and racial health gaps have persisted, and in some cases they've widened. But the primary focus of a lot of doctors and physicians is treating, actual disease, so diabetes, heart disease. But there's sort of a growing idea that by the time you're catching the chronic condition when somebody shows up at your health facility, health system, hospital, doctor's office, it's almost too late. And actually what you're looking at are really risk factors that are connected to this much larger thing. And the underlying problem is actually socioeconomic conditions, structural racism. And you've been a really big part of shifting our discourse towards this kind of model of thinking about, the trajectory of someone's health. So I wanted to ask you, what would a structural racism framework look like within medicine, and how can we build towards that?
Absolutely. One, I want to just say that I stand on so many shoulders of epidemiologists, social epidemiologists who have been fighting this fight and calling and attention to racism very explicitly as a public health crisis. And to point out what Dr. Anderson said, is these structural factors, these interlocking systems of oppression that continue to harm the health and well-being and keep communities from thriving, right? But a couple of things that I think are important, and one is clear definitions. What do we mean by racism? A lot of folks are using this term now to help us understand kind of racism and the health inequities that are emerging, especially during this COVID-19 pandemic. But I think it's important for us to understand, what are we saying when we say racism, and really pointing to not just these interpersonal interactions, but really the systems and structures that have caused such great harm, but also, as Dr. Kamara Jones points out, she says it's unfair advantage as well, and the privilege that comes with being a white American in this society, right? Mm-hmm. And we can't separate the unfair disadvantages from the unfair advantages, as well as the way the racism saps the strength of the entire community, right? So COVID exposed that, if none of us are safe, if no community unsafe, none of us are safe. And so racism is harmful for all of us as a society. But there's also been frameworks. For example, Dr. Chandra Ford introduced critical race theory as a helpful theory to help us understand racial inequities, back in 10 years ago, over a decade ago. And then I'll point out another focal point needs to be on the policies. What have been the very specific policy decisions that have been made at local, state, and federal levels that have led to, for example, persistent racial residential segregation, et cetera? And how do we understand the ways in which they continue to fundamentally shape health? And these are policies outside of healthcare system. And then finally, I think that it's important for us to never lose sight of the power that is embedded within local communities. So I'm really glad to be on this panel with Ms. Tawanda Austin, who is a community health worker who has her ear to the ground of these issues. And really it's that lived experience that we also need to be incorporating into our frameworks of understanding not only the problems within our communities, but also the power that's in our communities and the ways in which, even in this pandemic, even in Philadelphia, we saw community come to the aid when systems and structures failed. And that's what racism definitely causes harms, but it also brings out the power of communities who have been most harmed by these systems. So those are just some ideas of the things that I think are really important. We're excited to be incorporating some of that into our work at the Ubuntu Center that's launching this fall at Drexel, because again, we have to not only call and name racism, but also think about how we develop solutions to address it.
Absolutely. Thank you so much. Ms. Austin, I kind of wanted to ask you the next question, sort of to Dr. Barber's point of all these things that exist outside of the medical system that are also really important for healthcare providers, community health workers to keep in mind, to keep a pulse on the health of folks. So as a community health worker, you're typically paired with someone, people living in high poverty neighborhoods or who are battling a confluence of health or social inequities, from housing insecurity to high blood pressure. And because you share lived experience with these folks, you can tap into certain things that perhaps their doctor or their health system cannot actually reach. And I was wondering, I know that you've talked to me in the past about a rotation that you actually lead amongst doctors and administrative folks at the University of Pennsylvania to show them, to take them through the process of something that you might do, throughout your community or for a certain patient. Can you tell us a little bit about what that actually looks like and why that's actually something that's really helpful and could be used within more healthcare health system models?
Sure. First, that is my favorite program when we do that. The doctors, they come in, so we do nurse practitioners and up and coming resident doctors. And what we do is plan out a day where they follow us in the field, and it seems like things never go as planned. So when we go to the places, sometimes you might see that they are like, okay, well, let's just get this over with. That's sometimes the attitude, or some of them are really excited to go, but we walk into very different things than what they are able to see outside of just being inside of the clinic. So anything can happen. I've had an incident where we went to, I guess, the 46th Street West Park housing projects. And just for them to see that, because the resident doctors and the nurse practitioners are not necessarily from Philadelphia areas, they're from like all over. So when they get a chance to see that place, which a lot of those patients are Penn patients, and to see that atmosphere, that environment, some patients don't own furniture or had to get rid of the furniture because of infestation of some type of like bug. So, or they may see the stairwell, going into the stairwell, it can be very difficult to see, or just the fact that you had to wait 10 times for the next elevator to come down because the capacity can only fit about 3 to 4 people. So people who live there, they have to go up first. So we have to wait a number of times for the elevator to come back down. So that is really interesting to see how they grasp the things that they're actually witnessing in the experience that they get to be a part of. And at the end of the tour, some of them want to come back. They always contact my supervisor and ask, can they be my partner again? One time I took one of the resident doctors to another apartment building, and we did something very different. This was actually a nice one, so I wanted them to see that not all patients live this way, that some get the chance to live this way too. So we actually were cooking. We made peppers with turkey meat, and we got a chance to just interact with that patient, and it's a really enjoyable moment that they get a chance to experience, because not all of it is bad, but we want them to get the whole idea of what patients get to go through. And I always ask them one question: what did you take from it, or what would you do differently? And they always say that I'm going to be more patient and listen more, and I'm not going to just always assume the worst. So I really love that program. It's a really good program, and it's a great opportunity for me and them when we do it.
Absolutely. I think what's so powerful about what you just shared, Ms. Austin, is that there's so much that happens like in this continuum of care that sometimes doctors and physicians actually just don't get to see. And you're just there in the everyday, working with folks in that day-to-day. Before, in so many ways, the clinic or the hospital, it's like the last site where people come to sort of have these different needs addressed, but you're really sort of moving through this whole continuum of care before they're even in the hospital. And I wanted to ask, sort of to shift the question to Dr. Anderson, the Philadelphia Negro, while it was the first socially scientific study to study the urban poor, it was also one of the first studies to actually study race and its sort of caste-like implications on communities of color. And so an audience member, Tamala Carter, wanted to know, what did the impact of a contribution of this kind have within and beyond the field of social science?
Well, it's very important to understand that the book was published in 1899. And at that time, of course, we had clearly a caste system of race relations in this country, and since that time, a lot has happened, of course. Black people continued to move from the South to the North. The ghetto areas expanded. We had riots in the cities all over the country, really. And when Du Bois was doing his work, of course, the Black people were marginalized, and he represented them, talked about them, and talked about how they weren't making it compared to the Irish and the Italians and the other people who were white. And very oftentimes, these people conspired in many ways to keep Black people down and ultimately ghettoized. Over the years, the ghettos, as you all know, increased in size and ultimately exploded in the culmination of the civil rights movement, in the 1960s. And of course, we had the incorporation process, as it were. So we had the growth of the Black middle class, and it's bigger than ever. Today, a book like Du Bois's book would have been maybe well received in some ways, at least symbolically. In those days, the book was not well received. It was virtually ignored by the white scholars, many of whom were quite racist. Du Bois was unique, He was like a freak. I mean, compared to the whites who were dominated academia and what have you. And he wrote this book not really for Black people. He wrote it to try to educate white people. He started the book with the idea that there was such a thing as the benevolent despot, which white people who were ignorant of the racial situation, because why else would Black people not be able to work in companies and factories and what have you, like the Irish and the others, And he felt that the reason that Black people were not working in these places was that the white dominants were ignorant. So he set out with this book to educate them, to edify them, And halfway through the book, he realizes that this person does not exist. This benevolent despot, as he called him, And he changes his whole view and becomes, I won't say cynical, but he becomes much more economically deterministic in his orientation and his analysis. It's a beautiful book to read, but you see him change up this way, that way, whatever. But basically, the book was not well received in that time. And of course, if we fast forward to this day and time, we still have a lot of the issues that Du Bois talked about way back when. And as I pointed out before, today we have the so-called iconic ghetto. And the iconic ghetto is based on racism and what have you, But today, the Black middle class is confronted with a peculiar kind of symbolic racism. In other words, we've had the incorporation process that has produced the largest Black middle class in history. We've got scholars, we've got doctors, we've got lawyers, we got business people who make huge sums of money, but they're still Black. And so as they move about in the white spaces of society, very oftentimes they're met with a deficit of credibility. And people assume they're from the ghetto, even when they've been in the middle class for generations, if you will. That's the problem today. And so some of the things that Du Bois faced in terms of discrimination and having his work ignored or even taken, this situation is problematic even today, in part because of this deficit of credibility and the association with of Black people have Black phenotype. Even Africans or people from the Caribbean, people assume they come from the ghetto, and they get this deficit of credibility. So there's a new kind of symbolic racism that is related to the traditional racism, and this is what we're dealing with all the time. This is why the cops beat up on Black people and kill Black people and when they're in white spaces, and people call the police on Black people who are using the swimming pools or taking a nap in a dorm. They assume these people are not middle class. They're from the ghetto, with all this, all the strange things you want to associate with the ghetto, these middle-class Black people have to deal with that. And you imagine the person who writes a book in this day and time, you know, I mean, even that person is subject to this kind of discrimination. It's a peculiar thing that's going on today. And DuBois's book, as I say, back in the day, was not well received, you know. And today, people who write books who are Black, they have issues as well, you know, in terms of receptivity. It's almost like the larger white society, the scholars and others, oftentimes communicate among themselves and still don't take the Black scholars as seriously as they'd like to be taken, if you know what I mean.
Hmm. Thank you so much, Dr. Anderson. We have a few questions. We're going to be moving into our Q&A session now, and we have a few questions from the community. The first one is for you, Dr. Barber. I know that you've done this work both across the United States and internationally, and Brazil, looking at various health outcomes in communities of color, Black communities in particular. And Mary Jo Soldaki wanted to know, is there a city or some geographic area in the United States that sustains vibrant, healthy, safe, and engaged Black, Brown, and BOC communities that you can speak to? What are some actions that people there have taken that enable and empower such communities? What unique characteristics stand out?
I think that's a challenging question, because I think even in what we would deem some of the quote unquote worst neighborhoods, in any city, there's always vibrancy. There's always, you know, ways in which community, I think, you know, comes together, and, you know, saw that demonstrated really powerfully during the pandemic with the kind of a rising of mutual aid networks that were supporting people who needed food, who needed access to different things like testing. For example, the Black Doctors COVID Coalition here in Philadelphia, who was providing free testing and then free vaccination sites within the communities that were hardest hit by the pandemic. And so, you know, are there models? I think there are always micro models of individuals and communities that have really powerful work that's happening within the communities. That work just sometimes is ignored, or is not amplified. I think it's important for us to kind of begin to look at, you know, where we see those or not invested in, right? And so I think there is a need to understand, you know, how communities, despite the structures, despite the systems, you know, create these alternative systems and structures to meet the needs of community when, you know, local, state, and federal decision makers fail to do so. So again, I can use what I've seen and observed in Philadelphia, even during the pandemic, as just an example of how some of that has come together, and what if we were to invest the resources in those kinds of solutions and things that have occurred during the pandemic, and also develop the kinds of policies that would undergird that. So that would be my response to that question.
Thank you so much. And Ms. Austin or Dr. Anderson, I'm wondering, you all have also done a lot of community-specific work in Philadelphia. I'm wondering if you have any initial thoughts to that question as well. In terms of communities that you see sort of embodying resiliency, yeah, and serving as models for the kind of like cities and world that we're kind of building for and talking about tonight. Well, Dr. Anderson, there is another question. Let's see. Okay, so Linda Morales wanted to know, did Du Bois create the study to just spotlight the African-American situation, or did he also hope to inspire change and improve things? I think this is really a question about sort of, one, what were some of the impetus for like doing the study for Du Bois, like separate from like the University of Pennsylvania and the funders, and then also what were some of the conclusions that came out of this?
Well, I mean, basically, the folks like Susan Wharton and others, they really chose Du Bois because they really wanted to know something about why the city of Philadelphia was going to the dogs, they claim. And he understood that they already had their minds made up to some extent. And he says this in his book, Dusk of Dawn. And as I mentioned, David Levering Lewis points this out in his book as well. I suggest you take a look at that book, you know. And his question, Du Bois's question, pretty much was, I mean, he understood that people saw Black people as a problem, but he really did wonder why, you know, Black people were not treated like the white folks and all that, you know, in terms of being able to navigate these systems and to be employed. I mean, he really seriously undertook this issue, and he realized that the reason that Black people were not able to make it in this society in the way that whites were was because of caste, racial caste. Basically, the white people had the advantage of white skin, and they were coming from Europe where they had experience in cities and all that. And they were really in competition with people who were just coming out of slavery, you know, coming out of the South and places like that. And so this was a terrific problem. And at the same time, Black people were beginning to move ahead and build a middle class of caterers and barbers and even educators and all. But each time they would sort of make their way, you know, you see the middle class beginning to emerge. In would come a wave of immigrants from Europe, and just like you know, water coming under the sand, it was just destroy the progress of this Black middle class. Again and again and again, he saw these waves of immigration that basically undermined the position of Black people. You know, he realized that, he saw that. He became very frustrated about that. In fact, as I mentioned before, halfway through the book, he says there's no such thing as a benevolent despot, you know. I mean, this captain of industry who would be far-sighted and would employ Black young people and encourage them to be productive citizens as opposed to allowing them to become criminals and thieves. I mean, these are his words, if you will. And so he just became very, I won't say cynical, but he was really disappointed, you know. And at the same time, he doesn't give up. He describes, you know, these structures. He describes the middle class. He describes the working class, the poor. He lays it out. He talks about church. He talks about various, you know, he makes various points. But then he at the end of the book, he talks about the duty of white people and the duty of Black people, so to speak, you know. And he says, well, the Black people ought to get themselves trained, and the Black elite needs to reach back and show the poor people the way and that kind of thing. And the white people, they should be nicer to Black people and all this and that, you know, kind of thing. And this kind of suggestion belies, to some extent, what he seemed to be getting at in the middle of the book, which could have made a person cynical, if you will. But it may be that Du Bois just wanted to get paid. You know? I mean, in those days when people did research, they wanted to get paid. If you know that, I don't want to attribute this to him, but basically, I mean, the end of the book is different from what he kind of discovered in the middle of the book. And today, such a book would probably be edited in such a way that there would be a consistent theme and argument and all, a linear sort of argument. And what you see in this book is a very circuitous route that Du Bois takes. It's a book of discovery. We can see him thinking, we can see him grappling with certain issues. And so the book is circuitous. It sort of moves this way and that way. And you know, and then he gets to this point where he just becomes very disappointed that this benevolent despot does not exist, you know, kind of thing. And then, you know, you can kind of see him kind of give up this enthusiasm. You know, if you read it carefully, you can kind of see this. But then he doesn't get completely mad at white people or, you know, whatever. He just sort of say, well, there's a duty that they have to perform, and there's a duty for Black people. Responsibility, you know, they need to show.
I'm glad that you brought up, just this concept of duty, because when I hear duty, I hear responsibility, Dr. Anderson. And I wanted, there's another question actually for Dr. Barber in this respect, because when I hear duty, I hear responsibility. And this person wants to know, do you see Philadelphia moving in a forward direction to enact legislation and create programs addressing root causes of racial health disparities in the built environment? I was wondering, Dr. Barber, because you do a lot of community-specific work across the country and in Philadelphia in particular, if there are particular programs and projects you can speak to here, and yeah, to this larger question of whose responsibility it is.
Right. I mean, and again, I want to say that I'm not a native of Philadelphia, and I'm learning, and from my view, I don't see a lot. I see folks talking about it, but I don't see the kind of cross-sectoral kind of integration of, different, folks talking about these issues. We haven't even declared racism as a public health crisis like over 200 cities and counties have done across the country, right? So we haven't even acknowledged and named it as a critical factor in addition to systemic poverty and other things. And so, the fact that we haven't named it, means that, we're not even, poised to address it. And so I do think that there needs to be more work on understanding, these inequities, because again, we still kind of default back to, inequities within the healthcare system, but not all of these other interlocking systems that, harm people before they even reach the healthcare system. Mm-hmm. And so I think that there is a need for us to really, as a city, reflect on what are these broader historical structural factors that have led to the conditions that led to the disproportionate impact, for example, of the pandemic in this city, and so many other health crises that were ongoing before the pandemic. So yes, it's important that we name it. It's important that we carefully articulate who and what are the drivers, and then develop alongside communities who are, again, communities have been working on these issues, calling out these issues for decades. How do we bring those things together to really move towards a Philadelphia that is healthy for all of us, where communities actually thrive and aren't just barely surviving?
Mm-hmm. I wrote a piece that Penn published on COVID and Black people. And if you Google my name and COVID and Black folk, you'll get this piece. It's a short piece, but it points out how alienated certain sectors of the Black community, tends to be. I mean, alienated from the wider society. At the same time, so many people work in these areas where they're exposed to the virus, and the alienation early on caused a lot of Black people not to trust the wider society and these entries to behave and to distance themselves. I mean, a lot of this is about systemic racism and the fact that people just felt this is not their place. They don't trust the wider society always, the white man, as they say,
Right.
It's in this piece, if you want to get the piece. It's published by the urban group at Penn. It's called Black Folk and COVID. So.
Yeah, thank you so much for that. I was actually thinking in the midst of us having this conversation, Ms. Austin, you and I worked on a story actually about COVID-19 and sort of the work that you were doing on the ground within the community when sort of this larger narrative about sort of vaccine hesitancy within the Black community was sort of unfolding. And I was wondering if you could talk a little bit about perhaps the patient that we talked about or other folks that you worked with during the pandemic. And of course, your work continues as we're still moving through this pandemic. What some of the challenges were, and then what you as a community health worker were sort of able to provide them.
I think for the most part, my older adult patients, they may have, I'm not sure if they were around when the Tuskegee experiment happened, but they were definitely prone to that particular, they were definitely prone to that. And I would say that because it lasted for like 40 something years, that was definitely something that, I'm speaking about the older adults, that was definitely something that they were very hesitant about. COVID-19 was like scary for everybody. in general. And then there was like, okay, all of a sudden we have a vaccine, come on, let's get it. And they're like, wait, no, because that was the hesitancy in regards to that. And then when you look at the younger generation, like maybe people who are my age, they have these different myths, like silly myths, like they're going to turn into zombies and just nonsense. When in fact there's a miseducation of everything. There was definitely a mistrust, and then the education factor around it. So that's definitely made it even more challenging. So what I did was I just took the initiative. I just got mine done. It was just the right thing to do to protect myself and others. I mean, I would rather protect myself and others than to not get it. So I guess I was the example.
Absolutely.
And yeah.
Thank you so much. And I want to thank our panelists so much for taking the time to have this conversation and sharing your insights with all of us. We're going to take a quick little break and we'll be right back. You're watching In DuBois's Footsteps, the Health of Our Cities Then and Now, a community conversation made possible by the Commonwealth Foundation and from viewers like you. WHYY is a member-supported station. To become a member, visit whyy.org/donate. Welcome back to In DuBois's Footsteps, the Health of Our Cities Then and Now. Through the riveting conversations we were just able to have with our panelists, it's clear that the impact of the Philadelphia Negro is far-reaching. And tonight, I want to introduce someone who's making the history of Philadelphia's historic ward more accessible to folks in the city and beyond. That's Taib Smith. He's the co-founder of Little Giant Creative, and tonight he's going to tell us a little bit about a special project he's working on with fellow collaborators entitled The 7th Ward Tribute. Taib, it's all you.
Sorry about that. Thank you, Sojourn. Excellent job moderating, and thank you also to the panelists. It's a riveting discussion. The 7th Ward is something that's very near and dear to my heart. My great-grandfather migrated to the 7th Ward in the early stage of the Great Migration in approximately 1923. And then I learned about the history of the ward from my mother, my grandmother, aunts throughout my life. And I would call myself an amateur historian. So as a vivid reader, I was reading Tasting Freedom about the life of Octavius Cato. I had been exploring some of DuBois's works, and I read Marcus Hunter's Black City Makers. And at the time, my fiance, who is now my wife, lived in Queens Village, and I was living in Fiddler Square. And on my daily walk back and forth between the two neighborhoods, the little blue signs would frustrate me that described elements of the Black community's history here to the point of anger. So when I walked by Tinley Temple, or I walked by where the first Black theater was, or where the first Black bank was, or if you know the history of Richard Allen and Mother Bethel Church, which was the first religious organization to study the Bible through a spirit of Black liberation. When I talk to my neighbors, because I now live in the 7th Ward, and I'm one of the 6% of African Americans who currently live in the 7th Ward, as an elder said to me at my uncle's funeral last year, when I described to him I lived in Rittenhouse, he said to me, Negro, you live in South Philly. All right, and that was really special to me because I like to tease my neighbors and tell them that I'm blockbusting and we're taking back the 7th Ward. So if we could go to the first slide, I'll tell you a little bit about the project. I have had the good fortune of being a serial entrepreneur in Philadelphia, and I've worked with arts organizations, I've worked with foundations, I've worked with tourism organizations, and I'll be frank with you, we have a neophyte understanding of Black history. And Black history is not just Black history, but it's American history. And Philadelphia is very fortunate to have one of the richest Black historical narratives in the Western Hemisphere. But most of the people who make decisions about tourism, marketing, hospitality are ignorant of our history and their own history. So to Moonshot, I welcome not just the people who are viewing this, but the relationships in our ecosystem writ large for people to participate in lifting up this history. Because I truly believe if more Philadelphians and more Americans had an understanding that Black people have existed somewhere between river to river, between City Hall and I would say Washington Avenue, since William Penn's first expedition, there has been an African-American participating in the building of the city. So we have monuments to carpenters who lived here in the 17th century that are funded in what's called Society Hill by federal, state, and private dollars. But we have very few monuments to this rich cultural heritage. So we have a call for artists and participants to create 4 permanent monuments at different places in 7th Ward to lift up this history. We were fortunate to win a grant from Pew Arts and Heritage. We also have partners in the Philadelphia Archives, the Mayor's Fund, the Philadelphia Archives, and Mural Arts. And I genuinely welcome more partners to participate in engaging and not just lifting up this history, but using this opportunity to enrich the region about our deep cultural heritage that exists here in Philadelphia. And I could say so much more, but I welcome any questions. And I also really just want to thank the panelists for such a thoughtful, engaging discussion that was frankly from a culturally competent lens. Oftentimes when we have these discussions, we talk about our history from a space of scarcity. And I think particularly when we speak of Dr. DuBois, we have to speak from a space of Black privilege. And one other thing I want to say, I had the good fortune of visiting his childhood home in Barrington, Massachusetts last week. And although it was an enriching experience, there was something sad about it. Because if you visit that town, unless you knew where to go, you wouldn't know he lived there. And I'll say in the Philadelphia region, we have approximately 2,400 monuments to Ben Franklin. And the monument to Octavius Cato on the south side of City Hall that went up in 2016 is the first public monument to an African-American in the city. So we have a tremendous amount of work to do in regards to telling a true American history through the lens of how Black people built this country. And lastly, I'd like to say, Sojourner, you did a great job. And thank you, Sandy, the whole WHYY team, and Joy as well for the invite. Appreciate you all.
Thank you so much, Taib, and welcome back. So in part, an intent to study social problems in the majority Black 7th Ward, W.E.B. Du Bois's goal was bigger than that. As he famously wrote decades after the publication of the Philadelphia Negro, I made a study so thorough that it withstood the criticism of 40 years. It was as complete a scientific study as could have been given, and it revealed the Negro group not as a system, not a cause, as a striving, palpitating group, and not an inert, sick body of crime, as a long historic development, and not a transient occurrence. In the years since Du Bois's 1899 study, racial health gaps have widened, And many of the forces like housing, employment, transportation that DuBois studied in 19th century Philadelphia continue to be part and parcel of the structural racism that impacts the health and well-being of Black and marginalized people across the country and the world. I want to thank our guests, Dr. Anderson, Dr. Barber, Ms. Austin, Mr. Smith, Professor Zuberi, for showing us a way forward, for continuing in the footsteps of DuBois and his grand vision. Special thanks to the Commonwealth Fund and President and CEO David Blumenthal for their support of health equity coverage at WHYY. Thanks to Dr. Michael Udell, Vice Dean and Professor of the College of Health Solutions at Arizona State University, and to the village of folks at WHYY who made this possible, to our engineer, Tina, Joy Soto, Sandra Clark, Joanna Long, and Chris Norris, many, many thanks. And thank you, our audience, for being here with us this evening. If you're interested in engaging in more health equity conversations, you can find The Pulse wherever you get your podcasts, and also check out WHYY's newest podcast, Half Vaxxed, which chronicles the rise and fall of Philly fighting COVID, available wherever you listen to your podcasts. Thank you so much, and good night.